And welcome back from the concurrent sessions that just occurred. We hope you have enjoyed those. But now we're about to introduce one of the highlights of the day. So I need you to all, wherever you're sitting, move forward to the edge of your seat because I think you're going to be that interested and exciting for this topic around genetic data sharing. To introduce our key speakers, I'd like to introduce to you Julie Beans with the Alaska Native Tribal Health Consortium, who many of you may have heard in one of the breakout sessions yesterday. Julie, take it away.
Thank you, Kehlani. So good afternoon, everyone, and thank you so much for joining us. My name is Julie Beans. My father's from St. Mary's, which is a village on the lower Yukon in Western Alaska, and my mother's from the Oneida Nation of Wisconsin. I'm a researcher with South Central Foundation, and I will be moderating this afternoon's plenary session. We have two incredible speakers who will be addressing the importance and concerns around sharing of genetic data in their presentations. First, we have Dr. Stephanie Carroll, who is Atna and a citizen of the native village of Klutdika in Alaska and of Sicilian descent. Dr. Carroll is an assistant professor of public health and the associate director for the Native Nations Institute with the University of Arizona. Our second speaker is Dillard, who's Inupiaq Eskimo. Dr. Dillard is the director of research for South Central Foundation. We have a 45-minute session this afternoon, and each speaker will get about 20 minutes to present with a Q&A section at the end of the session. So on the right side of your screen, there's a plenary tab, and under that plenary tab, there's a Q&A section. As audience members have questions, please feel free to enter your questions into this Q&A section, and if you can add which speaker your question is being posed to, that would be very helpful. So, all right, Dr. Carroll, the floor is yours.
Thank you, Julie, for that introduction. Hello, everybody. Before I begin, I just want to let you know that Denise is going to be running my slides, and I'm going to turn off my video in a second just to conserve bandwidth. I'm speaking to you today from the lands of the Wampanoag territory and the currently called Martha's Vineyard, Massachusetts. I'm usually coming to you from the homelands of the Tanatham and Yaqui peoples in Tucson or Tucson, Arizona. And so I'm on vacation and I have weak bandwidth. So thank you in advance to Denise and all of you for hanging in there with no video. I'm going to begin with a very broad overview by introducing Indigenous data sovereignty and the care principles for Indigenous data governance. And I'll finish up with some explanation and some high-level examples about putting Indigenous data sovereignty into practice and why we need to think about multiple levels of activity in order to have trust within our data systems and also within our research to engage around genomic data sharing and genomics research. And then hand off to Denise, who will give us some really great examples of this work from her experience. And so next slide, please. And notably, I want to just start with who are Indigenous peoples and you know, let everybody know that from an Indigenous data sovereignty perspective, we underscore that there is not one official definition of Indigenous peoples, and what has evolved is a modern understanding based on cultural continuity, relationships with territories, distinct social, economic, and political systems. And that while recognition by nation states, and this is kind of the crux of it, so that while recognition by nation states and other governments afford privilege and also can be leveraged in exercising sovereignty, it does not establish sovereignty, which links to not establishing Indigenous data sovereignty. And so, you know, today's population estimates worldwide are widely accepted as undercounts. So while we have this 370 million Indigenous peoples, it's thought that within Asia, especially, there's almost that many people. And so the important point here is that Indigenous rights persevere whether they are recognized or not and whether they are written or not. Next slide. To give us some grounding in data perspectives, Indigenous peoples data include data generated by Indigenous peoples as well as by other governments, private sector, other institutions on and about Indigenous peoples and their territories. These data broadly include data, information, and knowledge in any format that impacts Indigenous peoples as collectives and as individuals. So Indigenous peoples data comprise information and knowledge about our environment, and non-humans, which we have relations. So these can be flora and fauna. Information about Indigenous peoples such as specimens, health data, census data, and so on. And information and knowledge about Indigenous peoples as collectives, including our traditional and cultural information, oral histories, ancestral and clan knowledge. Next slide. Indigenous data sovereignty, then, is the right of Indigenous peoples to govern their data from collection and storage to use and reuse. Finding its foundations in inherent sovereignty, only Indigenous peoples and nations as rights holders can exercise Indigenous data sovereignty. Indigenous data sovereignty is a responsibility and an expression of the ways, traditions, and roles that communities have for the care and use of their knowledge. Using a human rights framework, Indigenous data sovereignty leverages tools such as laws, policies, agreements such as the UN Declaration on the Rights of Indigenous Peoples, nation-state recognition of Indigenous peoples, treaties, and other mechanisms. Indigenous data sovereignty underscores that knowledge belongs to the collective and is fundamental to who we are as Indigenous peoples. So ultimately, Indigenous data sovereignty really works to relocate authority over data and samples back to Indigenous peoples. Next slide. Data are critical to the exercise of tribal sovereignty. Indigenous peoples require data for governance and self-determined decision-making. And at the same time, Indigenous nations, like many other governments and institutions, create and enact data policies and practices that align with their values and knowledge systems. So these activities of Indigenous data governance are means of implementing greater Indigenous data sovereignty. And what we see now is that Indigenous nations rebuild their governance systems. They're also reclaiming and rebuilding their data systems. Next slide. While Indigenous peoples, whether federally, state, or unrecognized, are rights holders with respect to their data, there are many other data actors. What are the responsibilities of these other stakeholders when stewarding and governing Indigenous data? All these entities need to change their practices and align with Indigenous expectations of data rights to create scaffolding of policies and practices that allow full expression of Indigenous. Of it as, a nonprofit changing their policies or making one tweak to how they engage with their Indigenous nation partners to make their data secure. And by making all of these small changes across the board of all these institutions that work with Indigenous peoples, we begin to see larger and larger changes taking place. Next slide. So currently, Indigenous peoples often face a state of data dependency where Indigenous data and tribal data systems have long been suppressed and usurped to meet others' needs and desires. Things such as federal government reporting requirements, question asks and research that are defined by outside inquiry and not informed by community needs, and so on. So the slide itself can be a presentation or a book. The takeaway message is that everyday Indigenous communities engage with a variety of data systems and actors, resulting in the data that are created by other data actors for their own needs, or as we move up, by Indigenous peoples, for Indigenous peoples, or by Indigenous peoples with others. Each situation will continue to occur given the vast array of environments in which data are created, stored, and used today. However, in each, there's an opportunity to strengthen relationships to ensure Indigenous peoples' collective rights to define, control, access, protect, and use data. Next slide. Indigenous nations have various levels of control or possession of their data, with high levels of control over the tribal enrollment data and very little control over things like social and corporate data. Thus, data work for Indigenous nations as rights holders requires enhancing relationships with other data stakeholders and experts, and also being able to decide which data are most important to invest limited resources in. So, as in a focus on genomics data, there's large concerns now. And so we begin to see changes taking place at various levels, both in the relationships that, for instance, tribes and researchers have with federal grant-making entities, but also with how work is being done on the ground. Next slide. So in response to the increased generation and use of data and open data, big data, open science, and research environments, and the limited opportunities for Indigenous control, the CARE principles for Indigenous data governance were created and released in September of 2019. These principles set forth critical considerations for non-tribal data creators, stewards, and users, and are designed to guide the inclusion of Indigenous peoples in data governance and increase their access to data. The CARE principles really work to shift the focus of data governance from consultation to values-based relationships, and have been widely recognized as enriching the discussion of collective rights to data. Next slide, please. So the CARE principles provide this set of foundational guidance for researchers and others working with, using, or storing Indigenous data and specimens. The CARE principles include 4 principles and 3 sub-principles. They are collective benefit, which details that data ecosystems shall be designed and function in ways that enable Indigenous peoples as collectives to benefit from data. Authority to control emphasizes the need for those working with data to uphold Indigenous peoples' rights to and support their interest in data. Responsibility reminds us that those working with Indigenous data must center Indigenous peoples' self-determination and collective benefit in data relationships. And ethics focuses on using Indigenous peoples' ethics to guide decisions on harm, benefits, justice, and future use. The high-level CARE principles direct those interacting with Indigenous data towards regional, for example, the First Nations principles of OCAP, or tribal-specific data guidance. Next slide. So the CARE principles bring a people and purpose orientation to data governance, which complements the data-centric nature of the popular FAIR principles, which are findable, accessible, interoperable, and reusable. And the FAIR principles seek to increase data sharing. Thus, implementation of the CARE and FAIR principles together should be seen as necessary to allow Indigenous peoples to govern, access, and use their data, and to share on their own terms. Next slide. So we're in a situation now where currently the vast majority of Indigenous data, ranging from ethnographic material to biological materials to health data, and so on, are neither FAIR nor CARE. Indigenous collections and data can be hard to find. They can be buried in larger collections, such as corporate data sets, university repositories, researcher possessions. These Indigenous data are hard to find because they're often mislabeled. They do not indicate the Indigenous peoples who are related to those data, and then they're not searchable. Indigenous peoples largely are not the legal rights holders to many of these collections, and therefore these collections are not fair, and they do not perpetuate Indigenous provenance, so the connection to the data, protocols for use and sharing, or permissions for use and sharing, or other uses. Next slide, please. So in an international effort led by Dr. Nana Garrison and team, we updated a review of how nation-state policies address Indigenous concerns for genomics research. The publication details specifically how the US Common Rule, which regulates human subjects research, fails, seen here in the column outlined by red with lots of gray, to protect tribal collective rights and interests. So there are no requirements to engage communities, for community approval for secondary use of data and specimens, for community approval of research findings before release, and the Common Rule does not provide sanctions for misuse of samples or data. While this is disappointing, we know the Common Rule, which was recently updated, will unlikely change anytime soon, which really demands action in other sectors, such as federal guidance, university and tribal policies, and then the ethical practices and training that researchers receive. Next slide. I wanted to share this too. As part of her dissertation research, my colleague, Dr. Dominique David Chavez, developed this scale of levels of Indigenous community engagement and research. It's one of the many ways to assess for how researchers access Indigenous knowledge systems and how they engage with community members who maintain them. So this was adapted from a participatory agriculture research, and the scale is based on who holds authority and governance in the research process, ranging from on the left side, no engagement, up through full Indigenous engagement. So in her dissertation, she looked at a global systematic review analyzing 20 years of climate studies that included Indigenous knowledge And in their research, she found that 87% of the studies were extractive, representing this colonial legacy of research. Yet there are a number and an increasing number of studies, as well as grassroots community efforts that live on the self-determined end of the scale, so on this right side of the scale. And we really need to see further investment in the activities that are occurring here. So this is why I'm really excited to hear more about the work that Denise is going to share with us. Next slide. So we're concerned about implementing fair and care on already existing data, as well as instituting policies and practices to ensure that the plethora of new data created every day adhere to both. So Indigenous data governance can be put into place through laws such as tribal law, the UN Declaration on the Rights of Indigenous Peoples, or the Common Rule, through policy, including university, federal agency, and other organizational policies and guidelines, and through ethics that encompass standards, training, and tools to embed ethical practices in data systems. And finally, in infrastructures where we need to begin to see changes such as setting Indigenous data standards. But more tools are needed, as well as criteria to assess and evaluate how other institutions are enacting the CARE principles and Indigenous data governance. I'll give a couple examples of some changes that we've seen very recently. And next slide, please. For example, in Australia, the ANTHC, which is the Aboriginal and Torres Strait Islander Studies Code of Ethics, will be mandatory for any research with Aboriginal and Torres Strait Islanders in Australia toward the end of this year. Critically, the code, which emerged from Indigenous leadership for the co-production of federal policy, acknowledges Indigenous people's rights to manage collection, interpretation, and use of their information, their ongoing right to ownership, control, and access to research results, and they need to apply both fair and care together. Next slide. One of the other efforts that I wanted to share, this one led by Maui Hudson at the University of Waikato and Aotearoa, New Zealand, also an effort that Dr. Nerba Garrison and myself participated in. We address how researchers can respect Indigenous rights, interests, and expectations in research around genomic, including genomic data. In order to stimulate greater diversity and inclusion in genomics research by building trust, enhancing accountability, and improving equity. To these ends, we include a table with specific actions researchers can take that address Indigenous concerns and begin to fill some of the gaps left bare by the current practices that ignore collective rights and privacy concerns, such as protecting personal and community identifiers and improving publication standards and recognizing community rights and interests. Next slide. So a lot of what I talk about is very high level, but the perspective that I'm trying to bring to this is really the goal here is to create law, policy, and ethics and infrastructure that support Indigenous rights to Indigenous data throughout the data lifecycle and across data ecosystems, and to strengthen such rights by making changes, even minimal at first, across data actors, such as at research institutions, repositories, publishers, funders, all of those who touch or interact with Indigenous data. We need change in many places and at a variety of institutions and by individuals, and they all must be actively engaged in doing this. And so while we're moving towards having more in community-driven work, it does require changes at multiple levels to kind of have this reverberate throughout the whole system. So next slide, please. So I'll finally close with some high-level points for operationalizing Indigenous data governance. First, really leverage international norms such as the CARE and FAIR principles and the UN Declaration on the Rights of Indigenous Peoples. Second, while indicators and assessments exist for implementation of the FAIR principles, we're in need of tools and indicators to assess and enforce implementation of the CARE principles and Indigenous desires for the data and specimen management and control. So the process for the FAIR principles took 8 years, to create these indicators. And so leveraging pilot efforts in different research projects that are going on and at different repositories to implement CARE, and the experiences of those creating the FAIR indicators. The Global Indigenous Data Alliance, who released CARE, and collaborators hope to have some indicators available within a few years. There's also a need to both fund the hard infrastructure, such as like servers and the tools we use in an everyday data and biospecimen environment, and also the soft infrastructures in Indigenous communities to really invest in and grow Indigenous community-driven data and biospecimen management, and then other institutions to enhance trust and accountability in external data systems. So in the US, we have yet to see true co-production of policy on the scale seen in Australia, and also some work done in New Zealand, which embeds Indigenous rights, interests, and ethics in federal and other policies. You know, I would love to begin to see that change happen, where we can co-produce external policies that are to the benefit of all parties involved, particularly adhering to Indigenous rights. Finally, I'll just move to, we need to create, expand, and implement mechanisms within data infrastructure that embed Indigenous provenance, protocol, and permissions. So this is changing our data infrastructures where you put in the story of data or the metadata so that you can have the expectations for sharing, future sharing, the expectations for consent, and in the future embedded with those biospecimens and data. Next slide, please. This is just a thank you to those who work with me and an acknowledgement of all of their effort putting into this. And at this point, I'll hand over to Denise. So thank you for running the slides, Denise.
Absolutely. So first of all, I want to thank Dr. Carroll for that really nice kind of overview at kind of a national, international level. And I'm going to be kind of making this discussion a little bit more local and Alaska focused. So I am going to kind of summarize what the South Central Foundation Research Department has heard from community members as well as leaders about genetic research, both the benefits as well as the potential harms, and what they've had to say about the sharing of genetic data. And then I'm going to end with how SCF kind of expresses sovereignty over research and data. I actually thought about leading with the South Central Foundation example, but our policies and procedures really are informed, and our practices are very much informed by what we've heard from community members and leaders as we have engaged in this work. But a little bit more about myself first. So my mother is Mary Mayak from King Island, Alaska. So that's the little kind of red dot off the coast of Alaska there with a picture of the housing on the island. My father is non-native from San Antonio, so very different backgrounds. My parents met at University of Alaska Fairbanks, and I was born in Fairbanks, mostly raised in Anchorage. So before I delve into genetic work, I wanted to kind of lay some of the groundwork in terms of how we first started talking with the community and leadership kind of about issues related to genetics. And that was really a study done starting in 2006, where we took a step back and really asked people their thoughts about research in general, but also about just even the collecting of specimens, much less kind of sharing them or storing them for future use. A little bit of background, there is a specimen bank in Anchorage. It's the Alaska Area Specimen Bank, and it's been in existence since the late 40s. In 2004, the Centers for Disease Control and Prevention Arctic Investigations Program asked Alaska Native tribal health organizations really to kind of assume shared ownership and management of this collection of specimens. And what we were asked to do was to really explore views of biobanking among the Alaska Native community across Alaska. And this is really kind of a new thing, this idea of managing a bank. And you know, what were the policies and procedures that the bank was going to use as tribal entities kind of assumed co-management. So what we did is we approached tribal health organizations across the state to partner with us. We hired community liaisons and ended up working in 14 locations. And we collected a bunch of interview and focus group information, so hundreds and hundreds of pages of what people had to say, and we analyzed this using a program called Atlas TI. This is a picture of a portion of some of the community dissemination materials that we developed, but you'll see in the middle kind of some of the questions that we asked. So we asked big picture questions about, like, what do you think about researchers collecting specimens from you for studies, and also more specific questions or decision points. So what should happen to a specimen if the person who gave it passes away? So what did we hear? The first thing that we heard was that many people brought up examples of past research or medical care in their communities. And unfortunately, many of these examples were not positive, and people felt mistreated by doctors, by researchers, others from the United States government. So people brought up, like, the Barrow alcohol study, the Havasupai research study that happened. And we also heard that in addition to feeling harmed, is that people really wanted specimens collected to be treated very carefully, that they were, a part of them, a part of their family, and that these should be treated with care, and that they're not just a biological specimen. With respect to genetic research, people had a lot of concerns and kind of the lack of not knowing, what could be done in the future with new technology. People did bring up things like cloning, for instance. There were concerns about research that singled Alaska Native people out in a stigmatizing way. And there was an overarching desire, if Alaska Native people did engage in this research, and there was definitely a recognition that research really could help Alaska Native people and their health. It could help now, but maybe it helps in the future and future generations. And we also asked people, what would you want to know when you were considering joining a study? And people really wanted a lot of information about the specimens, how they're stored. They wanted to know about the researcher. They wanted to know what was going to happen with the results. And we asked about permission, and people thought both the individual should obviously be involved in making decisions, but there was also a role with tribal health organizations of what research should be done kind of in their region. But we heard a lot of variability. So in terms of storing specimens, some people thought specimens should be kept forever and used in a more open way, where other people were much more cautious and thought that consent needed to be obtained every time the specimen was used. So once again, we heard lots of variability kind of across the state and across regions. But these were some of the general recommendations that we came up with. And really a lot of this is researchers knowing, getting to know the communities that they're working within and what do they want in place with respect to studies, data, and specimens, and to provide a lot of information in the conformed consent process. And that really what seemed to make sense is, given the variability, is that tiered rather than broad consent may make the most sense a lot of times. So tiered consent is where people may give permission to participate in the current study, but they may not give consent for their specimen to be banked. Or maybe they give permission for their specimen to be banked, but then they specify the types of studies that they could be used for in the future, or give contingencies on that, like it's okay to use them, but please get back in touch with me, and I would like to reconsent. Ongoing ongoing information sharing kind of throughout the study is really important. And people wanted to know kind of about their individual contribution. And then, of course, having community leaders reviewing and approving studies prior to publication and presentation to avoid things like the barrel alcohol study. So delving more specifically into genetic research, South Central Foundation then kind of embarked on a line of work which did culminate in collecting genetic information for pharmacogenetic studies, and that is basically looking at how people's genetic variation may impact response to medications. And this was a national network that we joined along with some other tribal entities. And we had kind of two conversations that are germane to this topic. So one, we had focus groups with Alaska Native community members. We asked about pharmacogenetic research in general, and then also, you know, how may views vary according to what the genetic research may be about. And this is kind of a big picture summary of what we heard is people definitely saw the potential benefits of pharmacogenetic as a more applied example of genetic research, that it could potentially decrease cost, improve health by getting people on the right medication for them in a more efficient and effective way, but that there were also risks that perhaps the technology could actually increase cost, which would then decrease access or have an impact on the healthcare system as a whole. And that, you know, the information really needed to be protected because it was sensitive and could be used. And then there was also the unknown applicability of some of the findings at this point in time. And so, you know, these findings may lead to some sort of change, but it might be in the future. And what we really heard is that there were kind of contingencies in that acceptability was higher if maybe the new intervention might be more effective, that it doesn't result in some people getting care and other people not getting care. And also that it directly involves Alaska Native and American Indian people, and that this capacity building was really important, and that over time, Alaska Native people would kind of lead this research and practice using genetic information, that it was done in a socially responsible way without stereotyping, and that it doesn't increase health disparities, which may have occurred with other technologies. And then, of course, that there's this participant and community protection. Here are some kind of quotes. So the first quote is really somebody just kind of sharing their perspective about genetic testing, and sometimes it's just testing being done, and who are the folks who are doing this, and who would be watching the people that are supposedly watching us. And then the second quote is really more about the potential promise of genetic and pharmacogenetic research, is that not wanting to be left out of the any developments in new technology kind of applications. There was also a meeting with tribal leaders and funders, as well as researchers, and really what tribal leaders kind of shared in this meeting is that there is support for research, genetic research, which translates knowledge into applied benefit. But benefits might be more long-term, and they might be poorly defined, like we don't actually know those benefits yet. And that these need to be balanced against the immediate potential harms like stigma. And then just an emphasis and a recognition that data sharing policies really fall under a trust relationship with the federal government, which require a tribal consultation, government to government consultation. So the last bit I'm going to go over in terms of research findings, and I'm going to skip over some of this just in the interest of time. South Central Foundation did host in 2018 an Alaska Native Genomic Research Workshop, and so we brought together funders from NIH. We brought together researchers who do work in this space in Alaska, as well as tribal leaders. And we did ask about a couple of different things. We asked about opportunities for this type of research, but also the challenges. And then we also asked about data sharing. One of the things that I really want to emphasize in terms of the opportunities and the challenges is people were, leaders in particular, were very clear, as well as researchers, that whenever there is a research study that happens, that this requires resource. And that resource, potentially takes resources away from other parts of the healthcare system. And, that really the potential burden and resource use really needs to be balanced kind of against the potential benefits. In terms of opportunities, there was also a recognition and a lot of discussion about the very robust policies for research review and data stewardship that we have in place within the state across different regions. We also have the Alaska Area Specimen Bank, and then we also have these information systems like Cerner and other information systems that really don't exist within other populations, which potentially paired with genetic information, if used correctly, really could result in some really unique uses and applications of genetic research. And I think I've talked quite a bit about some of the challenges. So this is what people said specifically about data sharing. I think everybody here may know, but if you don't, the National Institutes of Health, kind of in particular, has shifted to more emphasis on widespread data sharing. However, there are tribal exemptions to that, but sometimes those are a little bit less clear. But kind of what we heard from this audience was that this was viewed with a lot of apprehension, given experiences with research in the past, that people weren't necessarily opposed, but they wanted to have, strong protections in place, and that it would be a reciprocal relationship, that it be transparent, and that it be based on respect, and that there needed to be a lot more communication about both the benefits but also the drawbacks of data sharing. And there's lots of complexity to data sharing. You're collecting information not only about individuals, but also about their families and about their community members. And so, what are all of, how are all of those levels considered? There's, the secondary use. So somebody giving a specimen for one reason, but it being used for another. That needs a lot of discussion. Data security, we heard a lot in the press about data security breaches, and some of this information is very sensitive. De-identification is also complex in that one way of protecting specimens, genetic specimens in particular, is you may have specimens analyzed without any individual identifiers attached to that specimen. So really to kind of break that linkage. However, remember earlier slides where people just said, that they really wanted to know more about what their individual results are, and potentially some of these might be kind of actionable. But really kind of big picture, what people said is that really, this is not a yes, this is not a no in terms of data sharing, but really requires relationships and dialogue, as tribes may vary, and that there's this government to government relationship that is vital to the discussion. So I'm going to end kind of a little bit about South Central Foundation and kind of how we approach research. So just so people know, if you're not familiar, the part in the shaded dark blue area is South Central Foundation's region. SCF has been around since roughly 1982 and has just grown tremendously. In 2005, the organization developed its own research policy, which requires approval of all research. And this is at the beginning when there's an idea, a concept, and it goes all the way through the full review of the proposal, as well as any publications or presentations before they are given. And final approval is by our SCF Board of Directors, which is 100% Alaska Native. We do have a research agreement, which is germane to this topic, which specifies that the researchers, external researchers, do not own the data and the specimens. That they are that these belong to SCF and the people that these came from, and that there are required reviews and approvals for all secondary uses, and that hopefully there is a capacity building element. And then finally, another way that SCF has expressed its sovereignty over research and data really is to establish their own research department. So this is the department that I run. We do have a website, and we put a big emphasis on hiring and retaining Alaska Native or American Indian staff. And we really, first and foremost, what we try to research is defined according to the health priorities and interests of our customer owners and guidance from our board, but also funding opportunities. And kind of in a nutshell, kind of what I've learned over the last kind of 15 years that I've been doing this work is that, especially as I interface with more researchers nationally, is that Indigenous sovereignty over research and data often means that things are not done in a way that other researchers may be used to. So I know that we do not tend to do broad consent. We tend to ask people their permission in specific instances. We also prefer and require, actually for various studies, that the specimens and the data remain in Alaska. We have the technology, we have the capacity, and so we want that data kept here. And people may want their individual or collective results. And there are certain areas which are just which are sensitive. So assessing heritage, other things that might be really commonplace with other types of research studies, but these are not things that we want to take place. And we also know that genetic information is one aspect of people's health and of kind of their propensity for health conditions, but that, really we want this to all take place in a very rich assessment of the contextual or environmental other variables that happen. So there is this potential benefit and not wanting to be left out, but there's also these potential harms, and there's this question of immediate benefit. But kind of regardless, that really data sovereignty and Indigenous governance over research needs to be respected. This is my contact information, and you can also, you're welcome to reach out to me, and we have a couple minutes for questions, so I just want to thank everybody.
Thank you very much, Drs. Carroll and Dillard, for the very thought-provoking presentations. So again, please enter any questions in the Q&A section on the right-hand side, and I'll pull up those questions. Sorry, I'm trying to toggle. I think we have a... So, Dr. Carroll, are you aware of any U.S. federal reporting requirements that might be revised to better align with the needs or priorities of tribal communities, rather than, reporting requirements that create data that may not be of importance to the community?
Yeah, so this is a really important question. And I think one of the huge challenges that we have is that so many people are entrenched on the ground in doing the work and getting things to change, that we have great difficulty in sharing our successes. And one of the pitfalls of that is that if we don't know where other people have made changes, we're unable to leverage those in our own conversations, whether in our research or on the ground in our communities, to make such changes. And so I do a lot of work in environmental health and in some on the edges of climate change work. And so I do know that there have been federal agencies and actually different offices of federal agencies who will make changes, right, and allow communities to redefine what their outcomes are. The big point here is that we need large-scale discussion about this, and some of that is there's actually efforts in Canada to redefine for social and health outcomes, what those outcomes are from a community level up. And so that is moving away from things that's more bean counting and where people want to see change in, say, like a health outcome measure, to things that a community might want to see change from a project going on. And so some of those things are going back to, one community chose to have a count of how many females were in leadership roles, not only in elected leadership roles, but also in leadership roles in their community organizations as one of the outcome counts, because that was important as moving towards a community, a healthy community. And so, in the U.S., I know that the Forest Service has been helpful in some of the work to change outcomes, and there's increasing stories and engagement, especially from NIH and other entities, to be able to shift to have those outcomes be measured by how the community wants to do that. And it's not just the job of federal agencies. I also want to make a point too that nonprofits and actually funding and other funding, like foundation funders, need to make that shift. And sometimes it's really hard for them because of long ingrained beliefs about how you count your money, how your money is spent, and that kind of stuff.
All right, thank you very much for that response. We are out of time for this session. So if you do have any questions, please feel free to contact our presenters. And Kehlani, I will hand it back over to you.